And today the topic is going to be all about arthritis. I'm very pleased to welcome Dr. Wendy Holden with us today. Wendy is a rheumatologist and she's also a medical advisor for Arthritis Action. My name's Heather Baumohl-Johnson and I'm the Services Director at Arthritis Action. Sorry, I can never remember my title, but there we go. So today I'm definitely the Director of Services and Operations. Wendy, it's fabulous to have you with us today. I wonder if you could tell us first of all, what is arthritis?
Thank you. Arthritis is said to affect more than 10 million people in the UK. Sometimes there are no symptoms, but common symptoms can be pain, stiffness and swelling in the joints.
Okay. I understand that there are over 200 types of arthritis, which is a huge amount, isn't it? So your knowledge must be phenomenal. Can you tell us more about the two most prevalent types?
Yes. So the two most common types are firstly osteoarthritis, which tends to get more likely as we get older. And the next group is called inflammatory arthritis, such as rheumatoid arthritis, where the immune system goes wrong, and that can happen at any age. So firstly, osteoarthritis used to be called wear and tear or degenerative arthritis, but we don't like those terms so much now because we actually know that this process is actually a repair process where the body tries to mend itself, and it's that mending process that can sometimes cause some of the symptoms, the pain and the stiffness. So osteoarthritis commonly affects the knees, the hips, the fingers, usually one joint or two joints at a time, and the problems tend to get worse with exercise. This picture shows somebody who's got osteoarthritis in her fingers, so you can see the swelling that she's got in the end and the middle finger joints there. So the next type, rheumatoid arthritis or inflammatory arthritis, can affect people of any age. The immune system goes wrong, so we don't really understand what happens, but the immune system starts to attack the joints, causing pain, stiffness and swelling. This next picture is a chap who's got early rheumatoid arthritis, and you can see the symmetrical swelling there of the knuckles in his hand in particular. The pain of rheumatoid arthritis often gets better with exercise.
Okay, that looks quite painful actually.
It certainly can be.
Okay. So who can get arthritis?
Lots of people. The cause is unknown, so no one quite knows what triggers it. So some types of arthritis can run in families. For example, rheumatoid arthritis often runs in families. Injuries can increase the likelihood that you might get arthritis in that joint, so football injuries, for example. Being overweight can increase the risk of osteoarthritis, especially in the weight-bearing joints like the hips, the knees and the feet. Smoking makes rheumatoid arthritis much more likely. And there's an arthritis which is called gout due to crystals in the joints, which often it can run in families and can be associated with alcohol intake, although not for everybody that has it.
Okay, yeah, that's interesting because my auntie, she had gout, but it was in her thumb joints, and she used to have like crystals that actually came out of the joint.
Yeah, that's what it can happen in any joint. Most people think of it as just being in the feet, but it can affect any joints.
Okay. Yeah. Right. So, as there are so many different forms of arthritis, how is arthritis diagnosed?
Yes. So for osteoarthritis, there aren't really any special tests that you need to have done. Many people think they need to have blood tests or x-rays, but that's not necessarily the case for osteoarthritis. So if you're over about 40 or 45 and you have pain in a joint, particularly on activity, for example, in the knee when you go up or downstairs, or your knee starts to make some creaky noises and feels a bit stiff with exercise, then it's likely that you have osteoarthritis in that joint and you won't need to have any particular x-rays or blood tests. Inflammatory arthritis is different because you will need some special investigations for that. Usually you will go and see someone in a hospital, usually a rheumatologist, a specialist doctor, who will ask you questions about your condition, may well do some blood tests, and it's likely that you will have other tests such as x-rays, ultrasound or even MRI sometimes of the joints.
Okay, that's interesting. Interesting you mentioned there about x-rays, because I've heard that x-rays are not useful for diagnosing osteoarthritis.
Yeah.
So is this the case, and why?
Yeah, that's most definitely the case. So two main reasons for that is, first of all, in early osteoarthritis, x-rays can often be normal. And secondly, because there isn't much of a connection between what people experience in terms of pain and what the x-ray looks like. So this picture here is one of, obviously it's a pair of knees, and the one on the left, it's obvious that this knee has got very severe osteoarthritis. So this chap, in fact, has no pain in that knee at all. So sometimes x-rays can be normal with a lot of pain, and sometimes x-rays can be very abnormal with no pain. And that's often the case with back pain as well. So and even more specialist tests like MRI, for example. So this next picture shows two people who've got so they've got some problems with the discs in the lower part of their back. Both of them have got disc bulges. And the one on the left is somebody who's got a small disc bulge and lots of pain. The one on the right is someone who's got a very big disc bulge and no pain at all. So there's often no connection between imaging and what people experience.
That's quite interesting, isn't it? Because one of my passions is looking at pain and helping people with pain. And you would actually expect people to have more pain if the x-ray is showing that there's something wrong.
And that's definitely not the case. That's absolutely right.
Yeah, that's fascinating. I wonder if you could tell us maybe a little bit what it's like physically, what arthritis feels like.
Sometimes, as I said, no, but you may not have any symptoms at all. The most common symptoms would be pain, especially with activity, stiffness, which usually lasts just a few minutes, particularly in the morning and after rest, sometimes some swelling, and in general, symptoms are usually worse with doing things like gardening or lots of walking, for example. Many people with arthritis can also feel unwell in themselves, so they may have fatigue, they may feel a bit off colour, they may lose their appetite or may even lose some weight. So the symptoms can be very variable.
And I suppose then it makes people just feel pretty rubbish, really.
Definitely, yeah, can do.
Yeah, okay. So our members often ask us why joints make a popping noise. Is this arthritis?
Yeah, lots of people ask that question. So the answer is no, it's not arthritis, but no one quite knows what that noise is. It could be bubbles of gas being released from the joints. We know that once they've popped, it takes a little while for them to pop again. Or it could be ligaments or tendons snapping inside the joint. No one really knows, but not arthritis.
Okay. Here at Arthritis Action, we often hear that fatigue is an issue. So can you tell us anything about why this is and how to manage fatigue?
Yes. Fatigue is a really common problem. So somewhere between a third and a half of people with arthritis will complain of fatigue. And it's not just being tired, it's being exhausted. It's much more than the normal tiredness. There's lots and lots of causes for fatigue. So one of the most common would be pain. Living with a painful condition can be very tiring. People with arthritis often try and push themselves quite hard to get their jobs done because they feel guilty or they feel like they have to catch up, and that's called poor pacing. So people with arthritis need to learn how to do things gradually and slowly according to their levels of pain. Next, many people don't sleep because they have pain. They toss and turn all night, and that obviously can cause fatigue. Feeling low can obviously make you feel a bit tired as well, and being inactive, surprisingly, can lead to fatigue. So many people with arthritis cut down the levels of things that they're doing, and that can contribute to fatigue, as can carrying a few extra pounds in weight. So if you've got any doubt about that, try carrying a heavy rucksack around all day and see how tired that makes you feel. So it's multifactorial, really. The fatigue. There is some good news, though, about fatigue. Just as it's multifactorial in cause, it means there's lots of things that you can do to help yourself. So self-management can really, really help. For example, learning how to pace your activities better, so not doing too much when you're having a good day, doing some gentle exercise, trying to get your weight down if you need to lose some weight, and improving your sleep quality is one of the most important things that you can do to help with fatigue. We know that just improving sleep quality can really help with the pain of arthritis. So now I've got some of my top tips for improving sleep.
Okay,
so
excellent.
First of all, and one of the most important things, is having a nice environment in which to sleep. So have a nice cool bedroom, open the windows if you can, get some fresh air in, and make it as dark as you possibly can so you don't wake up on the light mornings. Make sure you've got comfortable bedclothes, a comfy mattress and comfy pillows. And if you can, try and take away all the flashing lights that you've got in the bedroom, chargers and things like that might disturb your sleep. And one of the most important things is to hide your alarm clock somewhere. So somewhere where you can reach it, but not somewhere where you're going to constantly look at the clock during the night, put it under the bed, something like that. Avoiding too much caffeine during the day and other stimulants, for example, alcohol, especially at bedtime, which feels as though it's relaxing you and helping you sleep, but will actually make the sleep more disturbed. Trying not to eat heavy meals just before bedtime is a good idea. Trying some white noise, for example, a fan or a boring radio program or earplugs can sometimes help. And new evidence shows that getting some sunlight or blue light, especially at lunchtime, can really, really help with sleep quality as well. Not so much close to bedtime, but during the middle of the day. Okay, so all of those things can be really, really useful.
Wow, there's a lot of information there.
Yeah, absolutely. Yes.
I love the one of hiding the alarm clock. I might try that one. That was really funny. Okay, so at our next webinar on the 10th of October, I will be talking about mental health and emotional issues caused by living with arthritis. But can you tell us why living with a long-term condition, such as arthritis, affects our emotions?
Yeah, that's a good point. So, first of all, many people with arthritis live with pain every day, and that can often get people down. So in addition to just the physical nature of the pain, people with pain worry about that pain and what that pain means. So common worries would be that the pain may become uncontrolled, the pain may progress, or that the pain means there's progressive damage. None of those things are actually true. Or people worry that they will become disabled as a result of pain. Again, that's not true, that it can disturb sleep and affect mood. In addition, living with a painful condition can cause worries to do with work, to do with relationships, to do with finances, and all of that contributes to the burden. And lots of people with arthritis find they don't want to talk to their loved ones about the pain that they're in and the discomfort they're in and the worry about losing their independence, for example. And all of that's very important for our mental well-being.
Yeah, definitely is. Yeah. Definitely. One of the things I was going to say earlier was that, thank you to everybody who's sent in questions, and we will try and answer them through the session. But also, you do have the opportunity to actually answer the questions, to ask questions now of Wendy. So if you've got any questions you want to ask, fill in the little box at the bottom of your screen and send those questions through. If we don't get a chance to answer them today, then we will respond to you personally via email. So one of the questions that we actually received, which actually resonated with me, was, does arthritis get worse? And can we halt it by taking the right actions? And does the pain of arthritis get worse?
Yes, that's a really, really great question, because lots of people worry about that. So the most important thing to say is that the pain does not inevitably get worse and worse. It can stop.
Okay.
And arthritis can stop at some point in its tracks. So this next diagram really illustrates the kind of things that you can do to help yourself and to do what you were saying about preventing arthritis from getting worse. So this is what we call a deconditioning cycle. So the red diagram on the left shows what can happen when we get pain. We then become fearful of movement. So if it hurts us to move, if it hurts us to go upstairs, for example, we stop using the stairs. If we do that, it's the wrong thing to do, because our muscles will then get weak, and then the next time we try and use them, it hurts even more. So one of the things that people really worry about if they have pain is that the pain means they're damaging themselves. That's often one of the first questions people ask me. They say, can I do exercise? Is it going to harm me? And exercise most definitely is not a dirty word. It's exactly what people with arthritis should be doing. Okay. And exercise cannot damage the joints. So to get out of that vicious cycle on the left, the red diagram, what people need to do to try and move to the green is, if exercise is hurting you, just try and go a little bit further into that pain to keep those muscles strong. Keep exercising, keep doing gentle exercise, and the pain will eventually subside and can even improve. There's great evidence that exercise can improve hugely the pain of arthritis.
Oh, that's good to know that exercise isn't a dirty word.
Definitely not.
So another question we received was, does having arthritis mean that you will become progressively more disabled?
Yeah, again, the answer to that one is definitely not. You can do lots of things in terms of self-management to help yourself. So exercise is probably number one, top of this thing that you need to do to keep yourself moving so you can remain independent. Lots of other things as well, though. So if you're carrying a few extra pounds, reduce those, because that can make a massive difference to your fatigue and your function. Looking at how you're feeling and talking about your mood and your mind and dealing with your emotions can be very important and help you cope better with those day-to-day challenges. Looking at your sleep, pacing your activities and positive thinking are all really, really important too.
Oh, that's really good. And we've got our own self-management resource online. And if you haven't had a look at that yet, then please do, because all of those things you mentioned there, Wendy, are actually part of that resource. So people can get more information on that, which would be great. The next question, which we often get asked, is osteoarthritis the same as osteoporosis?
Yeah, that's another good question. Lots of people ask me that one as well. They sound the same, but they're actually completely different. Okay. So in this next picture, this shows somebody who has osteoarthritis, which is a problem that affects the joints. So this person has a problem with the end joints in the fingers. The next picture shows a picture of what happens inside the hip in osteoporosis. The hip on the left is the normal one. The hip on the right is, you can see it's more full of holes, so there's actually less bone, and that's a hip with osteoporosis. Now, bones like that are more prone to breaking easily, and that's called a fragility fracture. So 1 in 2 women, in fact, over 50 will have a fragility fracture. And that's another reason why exercise is so important, because it can improve bone health as well. Often osteoporosis, I'll show you in the next picture, this is someone who has shrunk in height as a result of osteoporosis due to fractures in the spine. Some shrinking in height is normal as we age, as the discs become slightly drier. But if anyone has lost more than 2 inches of height as they get older, then that's something to pay attention to, and you need to seek some advice about that, because you may have, unbeknownst to you, broken a bone in your back.
Oh wow, okay, that's interesting. So you can break a bone and not know then?
Absolutely. In fact, most people who break bones in their back won't actually know they've broken it. Most are painless.
Oh, okay.
Unusually.
Gosh. Wow. Okay, so something definitely to look out for.
Definitely, yes.
Yeah. Is there a cure for arthritis?
I wish there was, but unfortunately, well, I don't know, perhaps I'd be out of a job if there was, but unfortunately, no, there is no cure, but lots you can do to control the symptoms.
Another question we received, again, this resonates with me because my mother has severe osteoarthritis as well, but this person was asking, my mother was disabled by arthritis and had to have both the knees and hips replaced. So does this actually mean that the same thing will happen to her? For her?
Yeah, that's what lots of people worry about. Am I going to become like my mum? So that is most definitely not the case. Okay, although some types of arthritis run in families, it sounds as though your mum had osteoarthritis, which has got a less of a link with families. And it's important to understand that in osteoarthritis, surgery is done for pain and just for pain.
Right.
So if you have arthritis and you don't have pain, then you clearly will never need to have surgery. Arthritis. And in a way, it's good to be prepared at a younger age, because it means you can do some of the things that you can do to avoid hopefully developing pain and those problems in the future.
Yeah. So preventative is the approach for somebody whose parents probably.
That's absolutely right. So keep your weight down, keep exercising, and be positive about it.
Yeah. Okay, that's good news. So what are the most effective treatments for arthritis?
Yeah, this depends on the type of arthritis that you have. If you have inflammatory arthritis, such as rheumatoid arthritis, you're very likely to need some medical drug treatments, in other words, to control things, because untreated you risk developing joint damage. So the most common treatments there would be treatments that we call disease-modifying therapies or biologic treatments, and those are likely to be essential as part of the package, really. For osteoarthritis, it's more of a self-management approach, although there are medicines that can help with pain and stiffness, for example, painkillers. and anti-inflammatories. Most people don't want to take those on a regular basis, which is absolutely fine. But self-management is vital, also important for inflammatory arthritis, of course, as well. So all the things we've been discussing, like exercising, keeping to a healthy weight, dealing with your stresses, getting some sleep, and pacing your activities. In addition, there's lots of other things that can help. There's physical therapies, physiotherapy, for example, osteopathic treatment, pain management techniques, for example, acupuncture can sometimes help. Occupational therapists can help with splints and devices, insoles for the shoes, sometimes joint injections, and all the way at the end of the line, joint replacement surgery. It's a last resort. Lots and lots of treatments.
Yeah, lots, isn't there? That's So it's good to sort of keep going back to the person who's supporting you and ask them, is this going to be good for me? Is that going to be good for me? And not just sticking with the one.
Yeah.
Okay, brilliant. How should people prepare for their appointment when they're going to see a rheumatologist like yourself?
Yeah, that's another good question, because people often get very nervous when they go and see the doctor, and then when they start to talk, the mind goes completely blank. So I think the thing to do is to get prepared is the most important thing. So write down what your most important worries is. You might have lots of worries, but try and think what your most important thing is. But especially with your GP, the time is limited, so you won't be able to discuss 25 things. So write down what your worries are and why you're worried. So if you're worried about what the pain means, write that down. If you have a pain, think about what makes the pain worse and what makes the pain better, so that the doctor can try and work out what's going on. If you don't understand what the doctor is saying, or they're using complicated words, ask them to slow down and write down those words, or explain in more simple terms. And don't be afraid to ask lots of questions, because that's what they're there for. So they want to help you to help yourself. So be prepared and be assertive is my advice on that one.
That's good. I mean, I often, when I get into the surgery, I can't think what I want to say. So I actually write, as you said, write it down, take it in. And sometimes I just give the list to the doctor and say, hey, can you help me with this, please? Do this. But also when they say that, explain something to me that I don't understand, I'll get them to write it down for me, so I can go away and look at it later and reflect on it, and then come back and ask a question if I want to later.
Brilliant.
Yeah. Okay. This is a big question, Wendy. How do you think the NHS will treat people with arthritis in the future?
Yeah, that is a good question. I think obviously with ever increasing pressures on health services, especially GPs, the focus is going to be on much more self-management. So if you already have arthritis, then really what you want to know, rather than you have to live with that arthritis 24 hours a day, whereas you will only see your doctor maybe a couple of times a year to discuss your pain. So you're going to have to be getting on with it by yourself rather than depending on the doctor. So I think that's where it's going to be going. And then on a more global scale, in terms of prevention, the government are already putting strategies in place to try to prevent long-term conditions such as arthritis by getting children to exercise in class, for example, doing the daily mile, and by giving children advice on healthy eating and things like that. So prevention in the first place, rather than treating the symptoms. I think that's the way it's going to go.
Okay, interesting. And I guess one of the other things that I've heard is that like physiotherapists and nurses may be trained as advanced practitioners. Yeah. And so a person might have a pain in the knee, for example, and they ring this GP surgery, and they've made an appointment with the advanced practitioner and not with the GP.
Yes.
Is that correct?
Yeah, that's absolutely right. So more and more of these advanced practitioners who are very highly trained, in fact often more trained in musculoskeletal matters than GPs are coming into place into GP surgeries, and they're an absolutely brilliant resource. So whereas a GP will have 10 minutes and they're usually focusing on blood pressure and smoking and things like that, are things where there are important, not more important, but to them more important health concerns. Arthritis tends to take a back seat. So if you have the luxury of someone who's got half an hour with you and can discuss smoking, exercise, weight, mood, they're going to be a treasure and somebody to be welcomed, definitely.
Okay, well that sounds promising. That there's more more support going to be available for people with arthritis?
Absolutely, yeah, definitely.
Okay, lovely, thank you. I understand we've got some questions, so this is exciting.
This is exciting.
Oh, okay, Wendy, can you explain the symptoms of rheumatoid?
Yes, that's a good question. So rheumatoid arthritis is, as I said at the beginning, is a problem to do with the immune system going wrong. Common symptoms of rheumatoid are stiffness, especially in the morning, that lasts for more than an hour or so. So people will often describe not being able to make a fist in the mornings, but it tends to loosen up through the day. And it's often the small joints of the hands and feet that are affected. In terms of the feet, people often say when they stand up in the morning, it feels as though they've got a stone in their shoe, or feel as though they're walking on pebbles. So that would be the main symptoms. Worse in the morning, better with exercise.
Okay, thank you. Here's a question. So rheumatoid is unpredictable. What do you recommend?
Yeah, it most definitely is unpredictable. So people often say they never know how they're going to feel the next day. I think once people have had rheumatoid arthritis for some time, they often know how things are, how they know that it's unpredictable, and they make plans to account for that. So I think be prepared, I think. So one of the important things is, if you're working, to tell your employers the problems that you have, so that if all of a sudden you suddenly come over extremely tired, then they'll know and they will understand. Make sure that you have some emergency medicines in your bag, for example. If you know you're going to have a busy day, make sure that the day before isn't quite so bad, and make sure that everybody knows what's going on, in case you feel as though you need to opt out of something, not just at work, but socially as well. So being prepared, I think is the key. It's the key there.
Okay, thank you. And here's a question: is there evidence wearing copper items helps?
That's a good question. I don't think there is any good evidence that wearing copper helps. Very interestingly, gold used to be a treatment, well, it still is a treatment for rheumatoid arthritis, and people used to find that the finger on which they wore their wedding ring was less affected by rheumatoid arthritis. So gold is a treatment, but there's no good evidence that copper is effective. However, if it works for you, give it a why not?
Yeah.
Why not?
Yeah. If it works,
try it.
Try it.
Absolutely.
Yeah. Okay, are there any more questions? Okay, so there's no more questions. So we will just remind you that the next session will be the effect of mental health, how to manage it with myself, and that will be on the 10th of October. And please join us there, and also look on the YouTube channel and watch our online self-management resource there.